Hi. I think in the last video I mentioned something about having a discussion around the anxiety process that we see Mum has kind of adopted and almost perfected in some ways, and the way that we pick up on the signals that are kind of predictors of the way that the day will go, or how she's actually how she's feeling. So often in the mornings, Mum wouldn't be able to comment on how she was feeling, or specifically what was making her not feel well. But we saw this process that she would go through that sometimes would go as far as leading her into a panic attack, but at other times just taking her to a very low place, a very anxious place that she would stay in for pretty much the whole day. Now, this may be affected by something that older people generally do. Maybe all people do it. Maybe some people are more predisposed to building up habits and these bad habits. One of the things that I've noticed with Mum over the years is this thing where no matter where she goes, she'll take a face washer or some sort of a cloth like this with her, and whether that's to wipe up spills or to pat her brow if it's really hot, or but very much the way that Mum uses a cloth like this is almost like a security blanket. And even before she was sick, I noticed that she'd be a little bit anxious if she didn't have her cloth with her. And funnily enough, if you have a look at her bedroom, there'll be 2 or 3 of these cloths around that they're always within arm's reach. It's kind of like a smoker always needs to have a lighter near them, or a mum might be compulsive about having wet wipes always handy if she's got small babies or something like that. But look, it's very much this habit forming process. So Mum would get up in the morning, some mornings, and we say, sometimes you don't even have to say to her, how are you feeling? But we knew that the process almost always started with this. Mum sitting in her chair, whether she's watching the TV or staring blankly at the wall, but cloth in a hand, head in a cloth, or head in the hand, and just sitting there. And she'd just sit there for a long time, and we'd just watch her like that. And after 5 minutes or 10 minutes or 15 minutes, maybe longer, I'd be trying to talk to her and she wouldn't be responding. She was deep in her thoughts, and after a period of time, we would notice her breathing getting quicker, and maybe a little bit irregular, but the head in the hand and the breathing quicker, and then she would be breathing more quickly or more deeply or more shallowly, but there was something that was definitely changing in her breathing. And then, like clockwork, after 15 minutes of this head in hand, the hand tremors would start, and really you knew what was going on when the hand tremors were going, and this was a process that we didn't see once and we didn't see twice. Sometimes we saw it every day for weeks in a row, and it was something that she obviously couldn't control and something that she couldn't break out of. So at some of the worst times, the head in the hand, the staring at the wall, the breathing going faster, the hand tremors, sometimes she would get agitated, and sometimes asking questions. Where are we going? What time's this appointment? When have I got to see the oncologist again? What did the doctor say again? Do I have enough of these tablets? These sorts of things, where she was obviously focusing on, what have I got to get organised? What have I got to do? What's this? What's that? What's the other? And it was, it was distressing for us, because you could see the process that she was leading into. And at times, I think I can say at least on 5 occasions, because they're the days that we ended up at the emergency department at the hospitals. But you know, the build-up would be so great that you know, she was in a full-on panic attack, and you know, she would need an Ativan, which I think is lorazepam is the chemical name, but Ativan is the drug. But you know, the doctor gave us these Ativans and said, you know, when she has a panic attack, you know, give her one of these, and obviously the Ativan was settling her down. But you know, on the bottle for the Ativan, and when you read it, it says, you know, for short-term use, you know, 2 to 4 weeks worth of use. But you know, mum was in this process so much, and it was almost she was almost dependent on taking the tablet to get herself calm. That, you know, after many months, we saw some really negative impacts coming out of taking the Ativan, and you know, mum at times would wake up in the morning, and as I've said before, you know, she'd wake up and literally start her day off with having a vomit. But you know, from some mornings, from very early in the morning, asking for an Ativan, need it now. And it's very difficult to negotiate through that, even though you know that giving her an Ativan at that time isn't going to make any long-term improvement, but just give her some short-term relief. And you know, we'd had her at the doctor a number of times over this, and there's not really a lot that they could do. We'd asked for a referral to a geriatric specialist, maybe they could help us. We'd asked for referrals to psychiatrists, maybe they'd have more in-depth knowledge, but we weren't really making any progress. When the panic attacks set in, mum at times, you know, was demanding, I want to go to the hospital, and on 5 occasions we did that, and what I found was this: we would go to the hospital, and on the way to the hospital, mum's asking why we're going to the hospital. I know what's happening, I know what you're doing. And we'd get to the hospital and she'd be wanting to go home. I just want to go home. I don't want to be here. But you know, I'd take her into emergency, and they'd take her through, and you know, they'd obviously see her age, they'd see how frail she is, and I have the utmost respect for the nurses and the doctors that work in the hospital system. But you know, they would take her through, and it was obvious that there was very little that they could do for her in that setting. Sometimes with the panic attack, mum was actually asking for more medication. But you know, she was learning that they're not going to give you more medication, so she was asking for it in different ways, and she was trying to, you know, suggest that maybe you could give me something that could make me feel better without asking for a tablet. And you know, they can't and they don't give medication out like that in emergency departments. On one occasion, it had built up, and it was so bad that delirium had hit, and they kept mum in overnight at hospital, and even at that time there was, you know, they kept her in under observation, but there was nothing really that they could do for her with regards to medication. They gave her that bag of magnesium. They gave her the enema. Got rid of the constipation, and yes, she came back pretty quickly. But it fell short of what mum was expecting from healthcare. And what I think mum was expecting was, I feel sick, give me a tablet, let me be well. And, you know, that's a process that I know a lot of people, especially a lot of older people, have gotten into, because it's kind of the way our healthcare system works in the West. Or certainly works in Australia, and it's something that I'm going to focus in very much on these videos, because the way that mum has been medicated over many years has been very detrimental to her health. Now, this is not a criticism of mum's general practitioner or the doctors that she's been seeing over the years, but very much their training is to diagnose problems, to come up with treatments, and often those treatments include medications, and some of these medications are more horrible than the disease that they're or the illness that they're trying to combat. But this process that Mum was going into with the anxiety, starting with the head and the cloth in the hand and the head in the cloth, and the faster breathing, the tremoring hands, the panic attack setting in, the questions, the inquiries. Have I got enough of this script? Have I got these tablets? What time's that appointment? What time do we have to leave here? I remember on a couple of occasions when this was happening, when we had doctor's appointments, me saying to Mum, well, we've got an appointment at 1 o'clock, and she'd say, what time are we leaving? And I said, well, we only have to leave at 20 past 12. And she said, well, but there might be traffic, we should leave at 12. And me kind of not wanting to get into a debate over it, okay, we'll leave between 12 and 12:30. And then as the morning would go on, then she'd convinced herself that the appointment was at 12. We've got to be there at 12. We should leave here at 11:30, or we should leave here at 1:15. And I even remember one time when we went into the Royal Brisbane Hospital in the city. We got there like 50 minutes early, just because it was easier to kind of just give in and go, okay, let's go. But that was just a part of the panic. That was a part of the anxiety. It's very difficult for Mum to control. It's very real, and for us, it's very difficult to combat, because you're either constantly fighting against this thing that she can't control, or sometimes you give her a bit of latitude and you kind of give into it. And I don't know whether we did the right thing, we did the wrong thing. Maybe I failed terribly, and that's why she was so racked with anxiety for 7 months. And I've got no idea what happened last Wednesday night. I've got no idea why on Thursday morning she woke up feeling much better. Wednesday, don't know whether I've said it before, Wednesday was horrible. It was really difficult. It made it even worse that it was my wife's birthday, and I wanted to make it a special day for her. And all day, Mum struggled, and I knew that if I gave in, I knew that if I took her to emergency, one, we'd get to emergency, she'd want to go home. But two, and then when we get home, she'd want to go back to emergency. But two, if we did go to emergency, once they took her in there, there's very little to nothing that they can do there, except they would do urine tests, and they'd take some x-rays, and they'd take a blood test, and after, 5, 6, 7, 8 hours, they'd come back and they'd say, well, there's nothing that we can do here, but we'd suggest you go back to your GP and talk to your GP. And I mean, this is a process that we went through several times. But for some reason, Thursday morning, Mum woke up and it was very different. And you could even see on her face that she wasn't racked with the anxiety like she normally was. And in comparative terms, the last week have been great. But what should you do if you're seeing the same sort of process with your loved one? What should you do if you see your loved one develop this own process of the anxiety onset? I can't give advice other than sharing what happened with us, and being flexible, trying to be caring. I failed many times with trying to go with the flow, or I failed many times trying to bring her to a healthier place. I guess the only advice I can give you is to do the best you can, to remain caring, to not get sucked in to the anxiety yourself, and don't let the anxiety that's controlling your loved one control your actions and your decisions, because sometimes I gave into it, and we didn't make any progress. So how do we make progress when it's occurring? Be patient. I think that's the best advice that I could give. That's it. I just want to talk about that process of, the cloth, the head in hand, the faster breathing, the tremoring hands, and then the onset of panic attacks. I will come back and talk specifically about medications and some of the experiences that we've had, because I think that's absolutely a foundation issue that we've had in mum's treatment for a long time. It's taken us a long time to sort out some of the medications and the side effects of those medications, but I'll leave that for another video. I hope you're getting some value out of these videos that we're making. I'm looking forward to reading some of your comments, and I'm looking forward to sharing some of our future experiences as we go through them. All the best for now, and God bless.